My name is Jen Boucher-Danzer. I'm the Executive Director at NAMI Yolo County, and I'm here this evening with several board members. So we'll have them say hello either in the chat or throughout the towards the end of the presentation. But I really am really happy to be here tonight and to be able to bring this presentation to all of you. So for those of you who might not be familiar, NAMI is the National Alliance on Mental Illness. We are the Yolo County affiliate here. And as one of the affiliates for NAMI, we are part of the nation's largest grassroots mental health organization that's dedicated to improving the lives of individuals and families affected by mental illness. Our mission here at Yolo County NAMI is to provide advocacy, support, education, and public awareness so that all individuals and families who are affected by mental illness can build better lives. So what do we do here at NAMI Yolo County? Specifically, we offer a variety of support groups. We offer support groups both for people who are living with mental health conditions themselves, and also for family members and loved ones of those living with mental health conditions. So we have a variety of support groups. We also offer educational classes, again, both for peers who are living with a mental health condition themselves, and also for family members and loved ones to be able to learn how they can support those loved ones and advocate for them. We also do a number of community presentations. This is the last of our spring series for our First Wednesday Gathering events. And this First Wednesday Gathering is really an opportunity for us to provide that community education to the population of Yolo County, and in an effort to help end stigma associated with mental illness and mental health conditions. So we're so happy that you've joined us here this evening. We also, I want to point out, we have an upcoming presentation at the end of June called Ending the Silence. And this presentation will be geared towards parents and caregivers and adults who care for middle school and high school aged youth. And this is a presentation that helps audience members learn about the warning signs of mental health conditions, and it covers what steps you can take if you or a loved one are showing symptoms of a mental health condition, specifically for this middle school and high school aged youth, how to talk to your child about that, how to work with school staff. And so for this presentation that will be coming up, we'll have two leaders presenting, one who will share a presentation, and then a young adult with a mental health condition who will share their own journey of recovery. So this is coming up on June 28th. We've dropped a registration link for that into the chat. So we would love to see all of you come back for that presentation on June 28th. That will be another one over Zoom. So we also have quite a number of resources on our namiyolo.org website, including resources for housing, food, that type of thing. So please, if you haven't checked out our website, please pop in and take a look at that, as well as if you're interested in any additional resources. So with that, I am so happy tonight to have a wonderful team presenting to you. We're going to have the opportunity to learn from Yolo County's Homeless Services team about the impact that homelessness has on mental health, the services that this team offers, as well as housing opportunities for all populations, including those living with a mental illness. So please join me in welcoming this evening Julie, Nadia, Sabina, and Chris, who are going to be taking it away from here to drop their knowledge with us. So welcome this evening, Julie. It's great to see you here. Thank you again for being here and being willing to provide this really valuable information to our audience.
Absolutely. Thank you so much, Jen, for having us. And thank you to NAMI, and thank you to everybody who is in the audience tonight. It's funny, after like 3 years of doing Zoom, that I'm still getting used to Zoom. So I'm partially Zoom fatigued, and then also like still learning new things about it all the time. So I just want to do a sound check and make sure that you guys can hear me okay. Is it okay? Okay, great. All right, I'm gonna go ahead and share my screen here. Get this party started. Let's see.
There it is, Julie. You did it.
All right. Tell me what you see. Do you see one giant slide?
No, you're not in presentation mode yet.
I'm not? Okay. That's what I was worried about. Let me
No worries. While Julie's working on that, I'll just give a reminder. I typed it in the chat here, but please feel free if you have questions as we go through, and you can type those questions into the chat. We'll be gathering all of those together, and we'll make sure to ask those questions at the Q&A at the end. So if you have a thought and a question, you don't need to worry about holding it to the end. Feel free just to go ahead and drop it right in the chat, and we'll make sure that your question gets addressed.
There it is, Julie.
Beautiful.
okay, give me 1 second here. All right. Y'all are back. All right. Well, thank you so much again. We are from Yolo County Health and Human Services Agency. This is the Homeless Services team. And we're going to introduce ourselves tonight. And first of all, I just want to thank my team for being here at 6 o'clock at night. And thank you again to NAMI for inviting us to present. Hopefully this works. See what happened. Uh-oh. This is why I did like 20 tech checks. What's happening? There we go. Okay.
There we go.
Is it, Nadia, is it in presentation mode?
Yeah, yep.
Excellent.
Yeah.
Okay, thank you. So we're gonna start. Sabina, do you want to start us off?
Yeah, I'm going to start. My name is Sabina. I'm a behavioral health case manager. As a case manager, we help clients get connected to primary care physicians, follow up with medical and mental health appointments, making sure they get to their appointments, but also advocating for clients during their appointments. We work with clients on housing, income, and acquiring basic needs.
My name is Chris. I'm one of the other behavioral health case managers on the team. I primarily serve clients in West Sacramento and Davis, and then Sabina is based in Woodland. And like Sabina said, we provide ongoing case management to help clients with their medical needs, but also to address housing and financial needs and anything else that may be coming up for clients.
Thanks. My name is Nadia Agnoli. I have the great pleasure of working with Chris and Sabina. I am the supervisor of the homeless service team, but these two need no supervision. I just try to make sure they have what they need to do the excellent work that they do in the community. These two really are the hardest workers on our team. They're out serving the community every day. I work I'm a program coordinator, so I try to make sure that we are meeting all of our metrics and all of our goals that our grants ask of us. And I also do quite a bit of running around on special projects that we're going to talk about a little bit later to give you a better sense of the scope of what we do on the internal homeless service team. It bears mentioning that this little microcosm of the homeless service team that you're seeing on your screen right now is a teeny tiny portion of the the entire homeless service spectrum that is working tirelessly in Yolo County. I think some of my colleagues are perhaps in the audience from some of the nonprofits that do a massive lift in our community to serve our neighbors who are living outside. So please don't be confused and believe that we are the only ones out here doing this work. We just want to talk to you about the specific work that we do. And we are grateful for the opportunity to do so.
Thank you, Nadia. And my name is Julie Freitas, and I'm a clinical manager for our forensics, mental health, SUD, and homeless services. There are a lot of things going on with those 3 programs, but it is an absolute pleasure to work with Nadia, Chris, and Sabina. So thank you all again for being here tonight. So I just want to do kind of a quick overview of what we're going to focus on this evening. And also just want to give a shout out to what Nadia mentioned about some of the providers that are on here tonight, but also just like that we're just a tiny small piece of this huge like homeless services continuum in Yolo County, which I feel like, you know, seeing it from when I started about 6.5 years ago to where it is today, I've seen so much progress. And so it's been great to see year after year, all the grants, all the funding that's been added, and all the staff that's been added. I think we used to have like 1 staff before, and before that we didn't have any. So here we are today. So we're going to talk about a little bit about our point in time count, and then we're going to talk about some brain science and the long-term effects of stress when experiencing homelessness. And then we're going to go into some of the services, some of the trauma-informed services that we do. And then we're going to talk about some of the housing options that are available, or some, you know, that are few, but we're going to really focus on the fact that housing is really needed in this community. And so then we're going to talk about kind of the pros and cons of each type of housing. And then we're going to talk about what we do, like what our tiny but mighty team does. We're going to talk about our collaboration with the mobile medicine van. That's a partnership with Communicare, Dignity, Sutter, other partners. And then we're going to roll into some of the other special projects that Nadia mentioned, and wrap it up with how can everybody get involved here in the audience, and then hopefully hear from you other ways that we can engage in advocacy and response to this issue. So thank you again. Hopefully my slides roll and they work. So let's start. Oops. There we go. So just a quote from Nelson Mandela to get us started: "It is in your hands to create a better world for all who live in it." And Nadia.
Yeah, so we want to start out by grounding us as a community here tonight, just a little bit to get us grounded in what the landscape of homelessness looks like in Yolo County today. To do this, we're going to offer a couple of numbers just to kind of ground us in these numbers and in these facts. So we recently had a point in time count, which is essentially in homeless service world like a census that is conducted every other year, where community members, volunteers often, and people who work in homeless services work to make note of every person who is experiencing homelessness in the county on that one snapshot of a given day to the best of our ability. This allows us, we report all of these to the various government entities, and then we track how we as a community, as a country, are doing over time. The snapshot that you see above is pretty interesting. I'm going to talk briefly about it. So we're comparing here on the left the 2022 numbers to the 2019 numbers. And we're looking on the third column at the percent increase. Nationwide, we are seeing an increase in homelessness that is not unique to Yolo. Something that is interesting though is our sheltered count total, which you'll see at the top. That's a pretty remarkable increase in sheltered individuals. And that jump from 2019 to 2022 is actually thanks to a massive COVID-19 sheltering initiative that the county put on and with great success. In response to the COVID-19 pandemic, initially to the governor's first shelter in place order in March of 2020, Yolo County, in partnership with several of our nonprofits, we lifted up 7 emergency shelters out of master leased hotels in a weekend, and we sheltered almost 300 at one point of our individuals who were experiencing homelessness throughout that time. That initiative lasted a couple of years, and we actually still have some hotels under master lease in order to provide quarantine space for people who are recovering from COVID or have been exposed. So that's where you'll see that 24% increase. Next slide, please. To break down just a couple of the metrics that we look at during this point in time count, part of the count is a survey where we ask the people who we encounter throughout this census whether they have experienced a number of different things that we collect in order to better understand who is living homeless in our community, so that we can better understand what programs we need to build or what housing supports we need to provide. This is a pretty telling count as well. So on the left-hand column, we'll see adults with serious mental illness, and then where they are staying. So rather in an emergency shelter, a transitional shelter, or living unsheltered. And then you'll see the totals in the far right-hand column. What this overall tells us is that we have a pretty sizable gap to fill for our housing and shelter programs in Yolo County. There are people with these needs in our community that are currently living unsheltered. There are gaps to fill here. One other minor note that I wanted to add is just to consider the kind of bidirectional relationship of these metrics with homelessness. So often we think of mental illness or substance use causing somebody's homelessness, right? Which is sometimes the case, but we see almost as frequently people entering homelessness and developing an anxiety disorder, or developing a depression disorder, developing a relationship with a substance they did not have before as a result of the experience of living homeless. And this is actually something that Julie is going to talk about in some depth here, is the experience of homelessness and the way that intersects with the experience of living with mental illness and the effect that has on a person who is living outside.
I needed to unmute myself. So we really want to just kind of highlight a special population because it's a pretty significant statistic, and that is LGBTQ plus youth represent as much as 40% of the homeless population. So there is a voice. So Chapin Hall is out of University of Chicago, and they did what they called the Voices of Youth count. And it's a national initiative to bring actionable evidence to prevent and end youth homelessness. And from 2015 to 2017, Chapin Hall conducted the most comprehensive examination to date of youth homelessness, incorporating youth voices, which is pretty exceptional and amazing. Because they wanted to develop achievable solutions, and the only way, that they were going to develop those achievable solutions was to ask the people who are experiencing homelessness. So since the fall of 2017, Chapin Hall has published 9 seminal reports on youth experiencing homelessness. They're online. You can check them out if this piques your interest. I want to say that I want to say that LGBTQ plus young adults experience homelessness at more than twice the rate of their peers. And LGBTQ plus youth are at greater risk for adversity before and during homelessness. And that the majority of homeless youth suffer from severe childhood trauma. So we thought we should really bring some attention to that population this evening. And as we go through this presentation, you can think a little bit more about that in ways that you might be able to get involved or advocate, for funding for certain resources, since this is a pretty phenomenal statistic and a population that really needs assistance and support. Closed on my thing here. So trauma is almost universal among homeless people. Not only does trauma increase the risk of homelessness, but homelessness increases the risk of trauma. As Nadia alluded to earlier, according to the Substance Abuse and Mental Health Services Administration, or SAMHSA, homelessness is a traumatic event. People who experience homelessness often live with a multitude of personal challenges. It could be the sudden loss of a home or adjusting to conditions of shelter life. It could be living outside in their cars. It could be living outside. And within the larger society, people experiencing homelessness often are marginalized, isolated, and discriminated against. They're highly vulnerable to violence and victimization, and re-traumatization becomes a distinct possibility for those living outside. I want to talk a little bit about good stress and bad stress. Good stress, it's called eustress. It's positive stress. It's like happens when you're doing things like taking a vacation or playing laser tag. And from an emotional standpoint, eustress can result in positive feelings of contentment, inspiration, motivation, flow, the things that really get you into like a good, frame of mind. Psychologically, eustress helps us build our self-efficacy, our autonomy, our resilience. And physically, it helps us build our body. So think of yourself like after a good workout, how that feels. Now, distress, which could be acute or chronic, and acute meaning like a short-term stress or an episodic stress, like let's say loss of a friend or a family member, a breakup, or it could be chronic stress, which is also labeled toxic stress, which is more long-term, and it's the most damaging form of stress. It could include, experiences like physical or emotional abuse, neglect, bullying, addiction, homelessness. It results in things like reactivity, hypervigilance, irritability, learning difficulties, uncertainty, or confusion. And when you're in the, your senses are heightened and you're releasing like a heightened stressful experience, it's prolonged release of cortisol. It leads to toxic stress and creates like a chronic fight or flight response and puts a person into constant survival mode. So let's say if our community goal is to make homelessness rare or non-recurring, we have to understand that it's a traumatic event that forces the brain and body into survival mode. I just want to focus on the prefrontal cortex for a second. When somebody's experiencing distress, like the slide says it all right now, but you can't learn new skills or pay attention appropriately because you're in survival mode. It literally turns off the part of the brain that's responsible for critical thinking, language, logic, and survival mode makes it so you can only concentrate on survival, food, shelter, and clothing. The brain doesn't have critical thinking and logic available, so the world is confusing. So understanding homelessness as a traumatic event is the first step to developing a comprehensive community strategy and approach. And I feel like communities that rely heavily on reactive services, such as emergency shelters, which we all know are very important to address the immediate crisis, those same spaces might not prevent or resolve the traumatic event over time. So people who are in crisis might easily get stuck in survival mode by virtue of the type of housing options that are available. So if you think about, you break it down to its basic elements. If people need the stability of a safe, permanent place to live, then housing as a basic physical and psychological need is truly, really healthcare. So once the brain is in prolonged survival mode, this turns into trauma. It's the same experience as like, confronting a tiger in the wild and that like fight or flight response and that reaction, right? So if it's like a short term, I'm just running from this tiger and to try to save my life, that's like a good thing, right? But if you're running from the tiger constantly and you're in prolonged survival mode, that can become maladaptive. It rewires your brain for constant stress response. Your brain gets overloaded with chemicals, adrenaline. You're hypervigilant for danger. And this is just showing the prefrontal cortex and the limbic brain. But homelessness can cause an activation of the limbic system and a shut-off switch of the prefrontal cortex. So all of these amazing things that our prefrontal cortex does, like empathy, insight, response flexibility, emotion regulation, all the things listed here, fear modulation, turn off, and you go right into your limbic brain, and that's where you might be living. As a result of that, you might have slowed thinking. You might only be able to understand every third word. That's a really big deal. Maybe you can't make decisions or connections. You have unregulated emotions. So when you think about these things as results of like long-term stress and being constantly in survival mode, if you think about being able to even access services or following rules that are often rigid, like in shelters or other living situations, or rules that are hard to understand, or even accepting services, really kind of makes you think like where people might be at when either they come into contact, with some of our workers or some providers in the community, and how that has an impact as they go through their work with them. So our team, has this value, this framework, trauma-informed care. And we are all always practicing this. This is not something that, anybody is an expert at, but you're constantly practicing as you encounter people. So I think what I want to say with this is that if we acknowledge that homelessness is a traumatic event, you utilize trauma-informed service approaches and recognize that permanent supportive housing is a solution out of recurring trauma, then you can build advocacy efforts to address the needs of our community. You can begin to provide the opportunities to build dignity, to restore power, and promote autonomy. Patience is required. Humility is required. It's hard work. It's not easy work. And so I just give it up to any provider that works in this profession, because it really takes a lot of patience and humility to work in this field. But I have to say, it really it pays off, as you'll see as we go throughout the presentation. So with that, I'm going to turn it over to Sabina and Chris that are going to overview some of the housing options.
Okay, so as an overview of some of the options that we have here in Yolo County, we have emergency shelters, room and boards, transitional housing, rapid rehousing, and permanent supportive housing. We're going to go through the pros and cons of each of them. So we'll start with the emergency shelter. Some of the pros are that clients have shelter from the elements and extreme weather. They have more safety. Food, showers, restrooms, and laundry are provided. There are on-site case managers to help with housing, finding work, troubleshooting problems, and just to talk if they need. Clients with income can save up as shelters are free. Some things that can make shelters challenging for clients are pet limitations. Clients are required to provide proof of vaccination for any pet. Oftentimes, there's only one pet allowed. That makes it difficult with people that have a few pets outside. There are rules such as curfews and quiet times that clients are not used to. No drugs or drug use on site, which can lead to bans. There's less privacy, and clients have to get along with others in social settings, which can be really difficult.
Sorry, can we jump to the next slide?
This slide, I think it's after that.
And then I think one more.
Yeah.
Thank you.
Room and board is another one of the housing options that's available in our community. With room and board, residents pay a monthly rent in exchange for a shared living space, and meals are often included in that cost. Since our clients share space with other residents, rent is usually more affordable than in a standard apartment. We've recently seen room and boards going for about $850 as a starting price. So that could be an option for someone who's receiving Social Security benefits based on age or disability status, but it does leave very little for other expenses. Room and boards tend to have more rules than a standard apartment since it is a shared living space, and location can also be a challenge. Many of the room and boards in our area are actually based in Sacramento. So if a client is placed in room and board, that often means leaving the county, and it may disrupt their already established services.
Next slide, please.
Transitional housing is a short-term housing option. They can help residents with crisis stabilization, and it might provide a step down from a higher level of care. In Yolo County, transitional housing often means a sober living environment, or SLE, where it's expected that the resident is substance-free and ready to engage with clinical staff on addressing some of their goals. There are similar programs for clients after physical or psychiatric hospitalization, but these are temporary programs. It's not permanent housing. One of the benefits, though, is that residents do have access to clinical supports and case management who can help them with identifying goals and making plans for next steps.
Next slide, please.
Our rapid rehousing programs in Yolo County are available through Empower Yolo, a local nonprofit. Rapid rehousing offers quick interventions and housing search. Clients complete an intake at Empower Yolo and are offered first month rent and deposit assistance if they qualify. Empower Yolo can also offer support to those who are still housed but close to eviction due to non-payment. Next slide.
Next slide, please. Next slide, please. Yeah, thanks.
And permanent supportive housing is a permanent option, whereas many of the other housing options that we've gone over are
Hey, Chris.
temporary.
Sorry, Chris, just a second. Can you see permanent supportive housing on the screen?
Yes,
Okay, it's just slow rolling for some reason.
no problem. Permanent supportive housing is a permanent option, whereas many of the other options are temporary. Permanent supportive housing in Yolo County also goes through the coordinated entry system, which we'll go over shortly, but it's a reimagining of the application process where rather than submitting an application for an apartment and then being at the bottom of the wait list and waiting months or years for your name to come up, permanent supportive housing is really directed at our most vulnerable community members. So we're taking into consideration things like chronic homelessness, experience with physical or mental or substance use conditions, limited finances, things like that. And we're helping our most vulnerable community members with attaining housing more quickly. Often, permanent supportive housing has a subsidy in the form of a project-based voucher that makes a unit more affordable for our clients who may have limited income, if any income at all. One of the cons is that there can be a long wait depending on the level of needs for a client. Since we are helping the most vulnerable people move in first, those who may have a lower level of needs may need to wait longer in order to move into an apartment. There are also pretty strict eligibility criteria. With permanent supportive housing, clients need to have housing documents such as a state ID, a social security card, or birth certificate that can be very difficult to get for someone who's living outdoors. Permanent supportive housing also often has on-site case management. And in Yolo County, we have permanent supportive housing on West Beamer and Woodland and West Capitol in West Sacramento. Those are very conveniently located for county and medical services.
Okay, so given the housing options that we just overviewed in the county, I want to talk for a minute about the permanent supportive housing option that Chris just covered and give a little bit of context. Some of you might work directly with clients in the community and be wondering how you might get your client into this level of housing. So I want to talk a little bit about what's called the coordinated entry system. So for a little bit of context, back when I started doing homeless services in like 2013, the case management was a bit of the Wild West. So in a large community where we were serving thousands of people, there was no real system of prioritization to determine who, of the 10 available units that we had, which clients would be selected to move into those units. So what ended up happening nationwide really was that the people who happened to be lucky enough to have an excellent case manager supporting them, like Chris or Sabina, or like our colleagues that were on the call from, Davis Community Meals and Housing, or any of the other, support systems that we have in our county. Those clients who are well connected would end up in the available units, which makes good sense. But as the housing crisis and the resulting homeless crisis increased multiple folds over the next several years, it started to become evident that there was some inequity in the way that people were accessing these very rare housing opportunities. And so a solution to that was introduced from the federal government, from HUD, introducing a requirement that every community have a coordinated entry system among their homeless service providers. And what that basically means is that each community is required to have something like an emergency room triage process to create some sort of order and equity that helps us determine who has the highest need in our community and is most likely to have an adverse outcome if they remain unsheltered and on the streets, and prioritizing moving those individuals into the highest level of supportive housing as quickly as possible, regardless of their relative level of deep engagement or any various other personal qualities that they may or may not have. So what that looks like in Yolo County and through most of California is an assessment called the VI SPDAT. Nobody really knows exactly what it stands for. It is a vulnerability index something assessment that every homeless service provider is required to use. And it is a standardized set of questions where we ask the individual across from us about various experiences they may or may not have had. So we ask about the length of time that they've experienced homelessness. We ask about family connection, about recent traumatic experiences they may have encountered, about medical conditions they may not have. And the result of this assessment that we conduct with them is a score that pops out at the end. And really this assessment is useful in two ways. It helps the case manager get a much deeper understanding of what is happening for the client that they're working with. It initiates a deep conversation about many of the things that this person may be experiencing and lets our case managers better understand what their needs might be. And it also creates an eligibility pathway for this permanent supportive housing option that is rare and very important in our communities. Next slide, please. If there are folks in our community who are curious about how they might get a client connected to this coordinated entry system, we have found, and it's sort of best practice when working with individuals experiencing homelessness, to have fixed sites where we can consistently be to provide a service, regardless of whether or not the person that we're working with has consistency in their housing situation. So in our county right now, we have a couple different entry points. And what I mean by an entry point is a fixed site with predictable hours and predictable staffing, where there are case managers on site who are trained to have this conversation, do this assessment with the client, and determine their eligibility for a housing option. So those entry points in our county are the Roadway Inn in West Sacramento is actually the product of our COVID housing initiative. It is a hotel that was turned into a permanent shelter. Actually, the county or the city of West Sacramento purchased it and is now a permanent shelter. Fourth and Hope is one of our entry points. That's our shelter in Woodlands. Davis Respite Center, Davis Community Meals and Housing, and outreach workers throughout the county. So that is Chris, myself, Sabina, Shores of Hope, Davis Community Meals. We all have, there are fixed sites, but there are also people who enter the community to do that outreach into the encampments, into neighborhoods, into places where people may have challenges getting to an entry point. So there's outreach and there's inreach, but these are sort of the fixed sites where you can predictably come in to get a housing assessment. Next slide, please. So this is, I also want to apologize. I currently have 4 dogs in my house. So one of them is barking. Excuse me for one moment. It's only a matter of time. Okay, so.
How did that not happen sooner?
I know, I'm impressed actually.
Yeah.
Of 4 of them, it took this long. Okay, so this is a brief flow chart to give you an idea of what this coordinated entry process looks like in practice. So I'm not sure if you can fully see, but on the far left, we have a couple of our referral sites. And my apologies, this hasn't been updated since 2019. We've had a couple of other things on our plate, so we will work on updating this, but this is not too far off the mark. And it gives you an idea of the flow of this work, which is the most important thing for me to communicate to you right now. So there are referral sites. These are places where there are individuals working for different agencies, 411, for example, Grace in Action. We had cold weather shelters in Davis. Their name has changed. but the services remain, Shores of Hope, the Veterans Center, all of these service providers are part of our homeless continuum of care and are aware of this process. Heart of Davis, thank you, Anya, is the name of the nonprofit that has formed from the cold weather shelter. So all of those providers, they can refer their clients to the next column here, to these points of entry, which we just discussed. So those are places where there are individuals who are staffed, who are trained and certified to do this assessment with a client. There's a specific program that we are trained on and the assessment we are trained on, so we can input this information. That yellow column just reflects the assessment, which provides a score. It is meant to provide some impartiality and sort of equity among all of the people who answer the same questions. The score will then be between 0 and I think 20 is the highest number. So this is going from the lowest level of vulnerability to the highest level of vulnerability up at the top. So at the very bottom, you'll see if somebody scores between a 1 and a 5, for example, most likely my recommendation is going to be that I'm going to send this person to an outpatient situation, Empower Yolo, for example. They have a great food closet. They have caseworkers that work on sort of an outpatient basis. They can help connect people to community resources. So very, very low, I'm going to refer people to affordable housing, to these community centers. In the kind of middle of the road, what Sabina covered in rapid rehousing, that likely is going to reflect somebody who has had some acute experiences of trauma or hardship, a recent job loss or loss of a partner, a recent move, illness in the family. So they may be experiencing homelessness in a more acute way, and an appropriate referral for them might be to a resource that can provide them with a shorter term financial stopgap to help them get applications in, secure rental assistance for the first couple of months, maybe a deposit assistance. So that would be a middle of the road referral. If somebody is scoring higher than an 8 on the VI SPDAT, it's likely that that person is going to be most successful in permanent supportive housing. That is that piece that Chris covered. They are permanent housing solutions that often come with a financial voucher attached. So somebody that has a fixed income, a senior citizen with a disability and a mental health condition, or somebody who is unable to work, has been homeless for a long time, needs somebody on site to check in with them regularly to be successful, that person is going to join our referral list for permanent supportive housing. That was a lot. Thanks. Next slide.
Is it showing? Okay.
So the Homeless Management Information System is HMIS. That is a local information technology system that is used by homeless service providers to collect confidential client level data. Like Nadia was saying, this is the program that our clients go through for coordinated entry. Clients have a profile set up and they complete the VI SPDAT assessment here. And HMIS is also vitally important for storing copies of housing ready documents and notes that we can share amongst each other so that we know what's going on with the client.
Okay, quickly, because I'm aware of time. I want to talk just a moment about our specific team, me, Sabina, Chris. We are one very, very small part of this continuum, but I do want to talk just briefly about the work that we do. Our team is funded by a funding source that is called CMSP, which stands for County Medical Services Program. The gap in services, like the need that we are filling, is significant. So for context, our hospital partners, our healthcare partners have noticed in the past several years that the following thing happens with some frequency. A person experiencing homelessness presents at the emergency department with some acute injury or trauma or kidney failure, heart failure, something that lands them in the emergency department. They're treated on site. Something more chronic or underlying is diagnosed, and they are sent home with a referral to a specialist or a follow-up appointment, or they are asked to come back to have the greater medical issue treated at a later date. That person returns to homelessness and often never makes it to a follow-up appointment for any number of reasons, right? They don't have transportation. They don't have somebody to watch their belongings while they go to a prolonged medical appointment. They don't remember the appointment that they had. If we remember Julie's presentation, we're in constant trauma response. It is really difficult to remember, where you're supposed to be at what time, figure out how to get there and prepare. So because of all those factors, they end up seeing the same person in the emergency department 2 months later, even sicker than they were 2 months before. That's where our team comes in. Chris and Sabina and I, our job is to connect with that person while they are ideally at the hospital before they've been discharged. We get a referral from that medical provider. We connect with that person on site. We make a plan. We get their phone number. We figure out where they stay. We meet with them. We help them connect to that follow-up appointment. And we bundle them up in our care, and we follow them ideally until we have helped them secure a permanent housing option and help them get control of the medical condition that brought them into our care in the first place. Again, with an awareness of time, Chris and Sabina, do you mind talking briefly about some of the work that you do and what that looks like in practice?
Yeah. So like Nadia was saying, our clients can be forgetful of their own medical conditions and appointments, and oftentimes they're poor historians. So they're not fully understanding of their medical issues and needs. So it's important for us to advocate during appointments if the client is comfortable with us going in with them and kind of reminding them about symptoms that they may have had that they forgot, helping them understand what the doctor's saying, complaints, and then just further helping them with their well-being.
Right. And with the medical advocacy piece, often we're helping clients to maintain their insurance, whether that's enrolling in insurance or transferring from another county. I've seen quite a bit recently where clients have Medicare and their particular Medicare Advantage plan isn't accepted by their preferred primary care provider, or we're having difficulty with referrals. So that's helping them with navigating their Medicare, appointment reminders, helping with transportation. I also help attend medical appointments. We address other needs as well as they come up. We can help clients with applying for CalFresh or general assistance, getting replacement cards if they've lost their card, working on subsidized telephones, and also working on trying to find permanent affordable housing for our clients.
One of the things that came out, again, of our COVID-19 community response was a really beautiful partnership with a new initiative that is operational now in Yolo County. It's a really beautiful collaboration between our hospital providers who are providing a lot of funding and CommuniCare health centers, who are providing the clinical care. There's a mobile medicine van that is operational in our county as of 2020 with the COVID pandemic. They have a mobile medical office on wheels that is literally out in encampments serving our individuals who are experiencing homelessness. We have a close partnership with the mobile medical team that started with our COVID-19 co-initiative, and then we did a lot of vaccine incentives. We did vaccine rollouts with the mobile medical team to encampments, to our hotels, to our shelters, to our respite centers, to our migrant work centers. And that partnership continues today with our CMSP program, where any client that Chris and Sabina are working with are co-enrolled with our mobile medical team if that person is still experiencing homelessness. so that we have physicians' eyes on every client that we have who is medically vulnerable, and they are able to treat that person on site and remove some of the transportation barriers. And we are also always doing outreach to clients who may not be enrolled in our program, but need medical and case management care in the community. Is this the short one, Julie?
Yeah, actually, I put the short one in here, but should we skip it and go to in their own voices to make sure we have time?
Yeah, I think so. I think
if you want to just talk briefly about COVID-19 and beyond.
Sure. Yeah, just briefly. Yeah, just wanted to brag about our team a little bit, since we are here and they work so hard. Yeah, I mean, aside from the medical case management piece, which is the bulk of the work that Chris and Sabina do, there's always a ton of curveballs that are thrown our way in case management in homeless services, as you can imagine, and some of you can relate to. We've had a massive role in the vaccine rollout during COVID-19, where our team was working with the mobile medical team and our public health team, having one-on-one conversations with our clients, going door to door at our shelter, our respite centers. We are out in the encampments weekly. We have office hours where we work in collaboration with our shelter partners. And the PSED, yeah, with our permanent supportive housing projects, these case managers and any case manager who works in homeless services in this county can relate with the experience of trying to get a client into permanent supportive housing. As a government funded program, as I'm sure you all can imagine, there are about 10,000 hoops to jump through, and they do it gracefully. And it's a massive lift to try to move somebody from homelessness into these units. And I just feel incredibly grateful to my team and the county case managers in general who are doing, I'm losing my voice, who are doing incredible work to do this massive lift. Julie has done a tremendous amount of work too to get the voices of our clients to you this evening. I think we should pass that on to Julie and to our clients.
Your voice is off the hook right now. Thank you. For anybody who would like to watch the 6-part series from Healthy Davis Together, it's really awesome. You'll see Nadia featured, you'll see Chris in there, and I think there might be a little bit of Sabina too, I'm not sure, but anyway, if you want to check it out, it's on YouTube. So we'll skip that for tonight, but okay. All right. This is where my technical thing's going to happen. I'm going to stop sharing and I'm going to share something new. Do you see a black screen?
Yes.
Did you say yes?
Yes.
Yes.
I see a black screen.
Okay, let me make sure it's on.
Okay, the video is showing.
Yeah, it's showing with sound, Julie.
What sound?
I'm doing it by myself. okay, I'm the only black woman out here in the SAC that was homeless, kind of by herself. It'd be a nice day. I didn't stay the first day, the first couple of nights I lived here, but like that. It's like, no, I'm not going to stay in here. I went back outside for a couple of days, and then I had my friend come in and just take a shower, whatever, feel better. You know what I'm saying? I was like, okay, this is real. And I'm playing with me because, you know, there's a lot of things happen to me, and then they take it away. So I've gotten used to just not, you know, I'm not gonna take it for granted, but now, I mean, honestly, I did a lot of things that was good for me at one time. Someone else had it, made sure they had it taken away. So I'm like, okay, well, now I'm just trying to find myself, who I'm gonna be, and what is it. It's not who I was, as who I'm gonna be. So that's where I'm at. I'm just trying to get my life together, get myself into the frame of mind where everything is really gonna be okay. You know, because I mean, we all are here on this earth for something, and I'm still here, and I'm still striving. I mean, it's all about how you perceive yourself in life. You know, I mean, we could be down here with nothing and still have something. So, I have more money. I want to drive a truck. You know what I'm saying? So I'm doing a Class A, and I'll be good. I'm gonna be traveling back and forth. That's all I'm gonna do.
That's cool. That's
With my dog.
That's
Don't promise a homeless person anything unless you're going to follow through. They respect you more than you've ever known. If you just follow, it could be like, oh, I'll give you a cup of coffee. They'll appreciate that. They'll see that more than you saying, oh, gesture, then, oh, well, I'll take you over here and let this person help you. You know, it's just some other people, they treat the homeless like they're criminals, but they're not. A lot of them aren't criminals at all. You know, they're just in a bad place. And a lot of them are very smart, really smart. Don't treat them like they're stupid, because we're not stupid. You know, we're far from it. A lot of these people have skills that a lot of you guys don't. You know, it might be from computers down to the wire. You know, it doesn't matter. But you know, it's treated with human kindness and with respect. That's it. Just respect the fact that we're all humans, and that's how it is.
Born in Sacramento 29 years ago. No, I was just kidding. Like 44 years ago, at the Southern Memorial downtown Sacramento, and like I remember being interested in music when I was watching Looney Tunes, out of all things, with Bugs Bunny. They were playing dueling pianos. Was Bugs Bunny and Daffy Duck, Donald Duck, one of those ducks? Yeah. And they were playing, I think it was the Litz Hungarian Rhapsody #2 in the middle of the song, where they were going. And I was like, you know, I became real interested in that. And I was like, Mom, this piano. She's like, I can't afford no piano. She's like, and then the Colton piano and organ, they had a blowout sale way out in East Sacramento, and I came home with a piano that same day. And it was pretty neat. And she was like, I can't get one. My credit ain't good enough. So I remember just knowing how to play. I didn't have to take the lessons or anything. It was like something that was kind of easy for me. I would just know what it sounded like, and I would just trust that my hands knew what to do, and they did somehow. And it was like, okay, I know what it sounds like. It's like, you know, and it would work. It worked for everything like that. So then in high school, they had a Martin Luther King Musical Scholarship, where all schools, all the schools had a college audition for to play their music, whatever. And the prize was, first place was $5,000 in $5,000 scholarship, and played 2 nights at the Sacramento Symphony Center for the Martin Luther King celebration. And first year, I won 3rd place. I think somebody got me for the fur lease or something. I was like, ah. So then the next year, I said, I'll tell you what I started out with myself. I call it the chase. And I won 1st place that year. And
Doing your own song.
Doing my own song, and then I won over all of the Sacramento School District. And it was real nervous.
Yeah.
So I remember one of the things that I really liked to do, or wanted to do, I should say, that Bugs Bunny did when he sat down with his pigtail tuxedo, and he had his ears were combed back like this, and he had the little slug, the look on his face. I can't, it was like he was just like everything. And then he goes to down at the piano. He got these white gloves on.
I know exactly what you're talking about.
And he throws it. He throws it. So his pigtail. But I did that. Okay, I was like, Mom. So I went to pigtail tuxedo. Pick up the pigtail tuxedo. And I did the same thing. Walked out there. His piano was like, oh, from here to here. Big gigantic piano. And I sat down and everybody fell out. Okay, I was at my campsite in Davis over off of Child, or one of the workers, Devin? Yeah, I think it was Devin. Okay. Yeah, he was like, if we're looking for you for housing, I said, for what? And then he gave me all the information, and then I was like, what? Housing? And then I got hold of number he gave me, and that they were putting the face building the building. and so
That's cool. Okay, are we back in business?
Yes.
Okay, excellent. All right, so let me just make sure. Yep, we have reached the end. Okay, great. So this is the part where we've just made a bunch of suggestions along actually with NAMI about how folks might get involved. And so, you know, things like lobbying your local and state officials to support affordable housing initiatives, host a coffee to discuss permanent housing options, educate and advocate for programs in residential community areas, become a landlord, donate time, vote, show up to county board meetings, or join an Hpac subcommittee, which is like super important. So we'd like to hear from you, some of the other things that you could think of.
Julie, can you tell us what is an Hpac subcommittee?
Yes, that's the Hpac is the Homeless Poverty Action Committee. And they're the look, I'm actually going to call on Nadia to really talk about Hpac because Nadia has been involved in Hpac for a good time now, and she can give a much better description than I can. So sorry, Nadia, for putting you on the spot, but
Sure, no pressure. Yeah, so Hpac is the Housing and Poverty Action Committee. So it's really open to anybody who is interested in participating in a governing body and like a decision-making body in our community. So Hpac is a newly formed nonprofit. There is a board and a president, and they kind of make decisions in our community. There are some requirements from the federal government about what has to go through an Hpac committee. So they serve in that capacity, but everything that the Hpac board does is informed by subcommittees, and those subcommittees can be attended by and informed by members of the community who are interested and who want to have a larger role in deciding what we're going to do as a community to tackle this massive concern. There are subcommittees such as a coordinated entry subcommittee. So if you are interested in having a voice in what a prioritization tool looks like in our community and how we are ensuring that people have equitable access to housing, come join us on the coordinated entry subcommittee. There's a technical subcommittee if your expertise is in reading grants and technical documents. Please come join us. We would love your eyes on looking at some of the grants that are coming down and making some decisions around how spending is happening, how our grants are being executed. There are also general meetings, which might be a great place to get your foot in the water. You're welcome to join. The general public, anybody is welcome to join. We welcome you, especially new people who have not yet participated but are interested. It's always nice to have a new perspective and a new eye. I think Anya has just put the link to the general meeting in the chat. Please join us. It's a good way to get to be part of the conversation and get your perspective considered.
Great, thank you, Nadia. We do have some questions that people have asked in the chat. Is it okay if I pose some of those?
Sure.
of course.
Okay, so where does the housing come from, and is anyone building more housing?
It's magic pixie dust that the housing comes from. It's really cool. Just add water. It's a lot of collaboration, and it's like when a funding source comes on, it's a matter of like who wants to jump on that funding source. So for example, we have a new partnership right now with Friends of the Mission, Yolo County Housing, HHSA. I'm forgetting one of the partners. Anyway, East Beamer Way, right there at the shelter site. They're building tiny homes. And so that's going to come online next in Woodland. And it'll be similar to the West Sacramento project, except this funding source. West Sacramento is no place like home funding, and East Beamer Way is Project Home Key funding. So it's going to be 60, I think 60 units, and 29 of those will be permanent supportive housing. I mean, it's all permanent supportive housing, but 29 of them will be specific to full service partnership services. So for you know, the most intensive mental health clients that we serve in our community, and the same thing for West Sacramento and West Beamer, we have certain units that are just full service partnership units, and the other units are open to like anybody else in the coordinated entry system in HMIS. So there's like a flurry of action that happens, you know, before we do these housing events, and that's happening right now. So IDs, social security cards, all those things are, you know, being worked on, and then people are getting entered into the HMIS system with their assessments by level of need, as Nadia talked about. So anyway, that's our next housing project that's coming up. In terms of other ones coming up, those are in the thought process, I would imagine, right now.
Can I just add one other thought to that? I think if I had to point my finger to one single biggest issue in our community, in California, in our nation, it's housing stock. So if there's anybody looking for a place to, you know, to push your advocacy, the issue really is affordable housing is not super lucrative for developers. And so there's kind of a monetary disincentive for developers coming into a community. It can be really complicated to get all of the funding streams in place. And that's not quick money for a developer. Finding land to put an affordable housing complex is often a massive battle that plays out in a like City Hall, like a Board of Supervisors meeting, or like City of Sacramento, for example, where I am a resident. There have been at least a dozen of initiatives in the last couple of years that legislators have brought forward to try and build more housing that's been shot down by neighborhood associations that do not want affordable housing in their neighborhoods. So these are the sorts of like hurdles that are coming up against that are preventing us from building the housing stock that we need. Usually affordable housing has some federal subsidy and some special interest funding that is connected with it as well. And so that getting that funding might be difficult. And then finding land and a willing developer is the other challenge.
Your dog agrees as well.
I know, I'm really sorry.
Thank you for pointing out NIMBYism.
Yeah, thank you so much, Nadia. A little bit along those same lines, I wonder if you all have thoughts on what can local governments do to ensure sufficiency of supportive housing.
You want to take that one, Nadia?
Actually, I'm really sorry. Can you repeat the question?
Yeah. What can local governments do to ensure sufficiency of supportive housing?
I'm not sure what the sufficiency of the support services or of the housing stock, or
I think that maybe relates to the having enough supportive housing, so the housing stock.
I mean, I think having people in. Oh, I'm sorry. Julia.
No, I was just going to say, I think it kind of goes back to the first, the first response, honestly. And if Nadia, you have more to add, please. Yeah.
I'm just trying to be thoughtful about the specific ask about how local governments can be involved. And one specific thing that I can give credit to our local government. There's a newly within the last year and a half executive commission on homelessness, which has some people who have more power than anybody in this our team has very little actual political power. We're just the workhorses on the ground. But this executive commission includes people on the board of supervisors and people in elected positions who are in the room really invested in learning about what the lived experience of our community members is like our teams and the challenges of providing the housing stock, of the lived experience of our community members. So having people who have political power in the room while these conversations is happening is critical. We've seen way more investment from our elected officials when they have been in the room during these conversations. And I think increasing that and supporting that and getting the people who are elected into their positions involved in these conversations in a meaningful way.
Wonderful. Thank you so much, Nadia. We are coming up close to the end of our time here. So I'm going to throw one more quick question out that is probably requires a very lengthy answer that you're not going to have time to give. But just to, for any thoughts you have, what can emergency rooms or healthcare providers do to support the county's medical services program?
Great question. I am curious about the person asking the question. I would love to know you. Please reach out to me. I mean, Julie and I are the leads for our team. We screen all of the referrals. We work with the referring providers. My hope would be that if you are a provider in county, that you might know who we are. If not before, I apologize. I hope that you know who we are tonight and know that we can be a resource to you. I will put my email in the chat and Julie's as well. If we are not yet connected, I would love to be connected with you. If you are a provider out of county, we sometimes have people in Sacramento County that we overlap with. Advocate for something like this team in your county, in Sacramento County as well. You can always email me. Thank you, Julie. Thank you for being at this presentation. If you're a healthcare provider as well, my spouse is a healthcare provider. We work actually really closely in these sorts of, we talk at the dinner table quite a bit about how we can make those worlds, medical worlds and social work worlds, work more closely together. Reach out to me if you have somebody that you'd like me to work with. And if you are not in county, advocate to your county to have a program like ours. I'm sorry if that's not a perfect answer.
No, that is wonderful. Thank you so much, Nadia. Tyler put some good information into the chat also about the West Sacramento Project Home Key site. So I know there were a few questions we didn't get to. So if you asked a question and we didn't get it answered, if you can leave your email in the chat or message your email to me in the chat, we'll make sure to get answers to your questions and follow up with you. But I want to thank our presenters, and I'm going to turn it over to our fearless leader, NAMI President Petrea Marchand, to bring us home tonight. Petrea.
Thank you so much, Jen. Thank you so much, Julie, Nadia, Chris, and Sabina, for the excellent informative presentation. I know you were busy presenting, so you didn't see what a prestigious group you have in the audience right now. It is a lot of the people that I know are either currently your partners or will be your partners, and it's a really exciting to see the team of people who are both engaged to see you tonight and also to hear about all of your services. I just wanted to commend you for challenging us to really understand people living with homelessness tonight. They are people living with a serious mental illness. They are people living with a substance use disorder. They are survivors of domestic violence. And also to really, educate us about the impacts on brain health from living with homelessness. I wanted to underscore a statement, Julie, that you made. Trauma is universal among people experiencing homelessness. That's like a chilling statement to me. I know it's true, but until I heard you say it, I didn't fully believe it and like feel it in my entire body. And NAMI National just yesterday hosted a panel of experts on trauma and all of the impacts from trauma, but also offered hope that there are opportunities to heal when you've experienced trauma. And I think your team, I just wanted to say this to you, thank you, every one of you, for what you do every day, because you are a part of that healing process. And every one of you who took the time to participate tonight is a part of that healing process. And I know that there's going to be some great relationships that occur as a result of this discussion tonight, because people understand better what's needed to help move forward. And I just wanted to emphasize that housing is an incredible, important component of that. The services that you're providing with coordinated entry, the work that everyone can do who's here today to provide more of the housing that we know is needed. It's just a really essential part of continuing to address the needs of people who are currently unsheltered. Yolo County will continue to be a part of that as well, providing support groups, education classes, and also advocacy. We will, for those of you who are here listening, please know that we are going to be helping to implement some of those recommendations that this team provided today. I'm talking to local elected officials, talking to community groups, and building partnerships, especially with healthcare providers, and helping provide some of those services as well. So we look forward to continue partnerships tonight. Appreciate everyone's time, and wanted to, last but not least, encourage you to fill out the survey. We do have a grant with the county, and they love to hear what you thought about the presentation. And also it helps us to better provide information that our community wants to hear when we get feedback. So Sadie just posted it in the chat. If you have a few minutes or want to email us, we can send you a copy of it over email as well. So with that, thank you very much and have a wonderful evening. And we look forward to seeing you at future Yolo County events, including the next one we have on June 28th, which is Ending the Silence. It's for parents of children who are living with a mental health condition who have experienced trauma, which I would argue we all have as a result of COVID-19. And it will help to continue this conversation about coping mechanisms and ways that we can help heal from trauma and help people living with mental health conditions. So thank you again, everyone, tonight, and have a wonderful evening.